right, just please confirm that y'all can hear me and we will get started. All right, cool. So hopefully, if you guys were here earlier, y'all are back again and we can get started from the top. So essentially, let me first introduce myself. My name is Ibreez Ajaz and I currently work as an internal medicine trainee in Plymouth at Dareford Hospital, which is in the southwest region of England. And I started working as an IMT in August of 2019. Before that, I was working as a trust grade doctor at a CT1 level in Yorkshire. And I had basically started my whole, UK setup with my internship experience. So in order to meet the criteria for IMT, I needed to have 12 months of experience after internship, and that's where I got it from that 1-year job that I did up north. While I was working, though, it was really difficult for me to try and envision what I needed to do in order to get into a training post, because like most of you, I'm sure, the thing that you want to do the most is enter into a training post, because that way you can progress your career and then move on to whatever specialty you want to get into. So thankfully, the trust that I was working at, the consultants were extremely supportive. The postgraduate medical center was also extremely helpful, telling me what I needed. But there is a lot of kind of work that you've got to do on your own to figure out how and what you need. So what I thought I'd do, and I apologize if I'm looking down, it's just I've got a couple of notes in front of me, is I thought first I'd talk about the portfolio that I submitted, and we just kind of go through it so that y'all can get an idea of what would be good to put in your portfolio and how to make it look nice and snappy. So aside from our posts on IMT about planning your portfolio and preparing for the interview, if you check on the main IMT website set up by the deanery and the likes of them, you can see what they want from you. And they do talk about extensively how everything should look and how everything should be arranged. But it's one thing for them to say it and then not provide an example. So I wanted there to be a little bit of a visual aspect in what we're doing so that you guys can know what's up. So the first things first, they ask you to put everything into a lever arch folder. Okay, so I'm going to show you, actually this is Ibrahim's because I wanted you all to see how beautiful and pink it was. But this is a lever arch folder. You can see that it has these nice little clasps in it to close it up and open it, and it's got a little bit of style, I guess. This one's got a hole on the side for who knows what reason. I don't know necessarily what you guys might necessarily call these back home. I know these can have different names. When I was growing up, these were called trapper keepers because they trapped and kept all of your papers together. But basically, it's just a binder, really, and the size is pretty variable. I don't think on the IMT website they've said specifically what size. I just thought this is a pretty good size, and you've got to label it, all right? Because there's going to be a bunch of people with these folders the day that you go there, and then the examiners or the interviewers also need to know, whose paper and whose folder they've got. As you notice, this is pink. Mine was bright blue. It doesn't have to be boring and black. Everyone's probably going to get black. Just, make sure it's appropriate and professional looking. So on the side, Ibrahim's got his name here, his GMC registration, and they give you a PIN. And he's also done the same here along with his application ID. It's just good to keep all of this information on there so that they know whose it is and there's no mix-up. You might be like, well, my name's pretty uncommon, but you never know. There might be another one of you out there. Although I have yet to meet another Ibreez, but I'm sure there's someone out there that's Ibreez. Okay. We'll get into the folder itself. So what we did, because we thought it would look really nice and pretty and make things really easy, is we put everything in these protective pages. So it's just normal kind of, page protectors. So the way the page protectors work is I didn't want them, there's a chance maybe the paper gets torn, or, I had chocolate on my hands and then I touched the page and, oh no, now there's a chocolate stain on my page. Actually, the first page I put in here is not something that you need in your portfolio. I just put it in here for you guys to see. This is just the candidate pre-interview briefing note. When you get to the interview center, they kind of give you this to give you a rundown, or at least our center gave it to us. to basically explain what you can expect from today. If you see on the side, and I apologize because it is super tiny, but if you see just about here, we've got these little tabs. And what I wanted them to do, because when you see on the IMT website, there's going to be an evidence summary form that you have to put in the very front, and that is where you're going to kind of basically, I don't have mine here because you have to submit it to them, but it's there on our website and on the IMT website. There are certain criteria, like, teaching experience or whatever things that we're going to talk about. So I put the page numbers on the side, and then I put them also here. So for instance, if the interviewer was like, oh, let me find out, what Ibreez's teaching experience is, and I put that as, on pages 1 to 5, all they have to do is get to that tab and flip to it. They don't have to flip through everything. And I know, like, our portfolio is not like super extensive, it's not very fat. And if you have a portfolio that has a lot of stuff in it, you want it to be very, very simple and easy for the interviewers to find what you've done, because that's how they're grading you. That's how they're knowing, are the points that you're talking about worthy to be given. Remember also, when you're putting everything together, that everything looks nice and neat. Don't, even if you're putting in a page protector, don't put in like crinkly pages, because that's not going to do anyone any favors. All right, so let's get through what we've got here. I've put in the CREST form in my portfolio just for the sake of showing that this is what the CREST form is. You actually don't need to have it in the portfolio, but you should just keep it with you along with your proof of English proficiency if you got it signed off by a consultant. You should also be bringing your passport with you. But we'll get to that in the interview section. Let's first talk about one of the sections that I have here. This is the teaching experience. Okay? So in the teaching experience, as you see, I've got my little, tab saying from what pages to the next pages, and I've put this little thing here. Even though they've not asked that you need to demarcate it like this, I thought, again, nice and neat, nice and simple for the interviewer. Okay? So here is essentially the proof of the teaching certificate that Ibrahim did. He had done a topic on headache when we were in A&E. And then he had the consultant basically put it on the template that our hospital had, stating that he, talked about this stuff on this date. And then, to further solidify it, we have provided the teaching assessments, or the feedback forms, that talk about, all the things where they're, established learning objectives, presented the materials, delivered up-to-date content, etc., etc. This feedback form was something that our trust had, and they gave it to us. But it doesn't mean if your trust doesn't have one. If you go on the JRCPTB, and that is very difficult for me to say, if you go on their website, they also have feedback forms that you can download. I know some people have even created their own feedback forms. They just have to show it to their postgraduate center or whoever's in charge of that stuff and get it approved. But a feedback form is pretty straightforward. You just want to cover all the main topics of what you're presenting and how you're presenting it. So he has several feedback forms that he's put in here. Okay? And then you can get your consultant to do one as well. It doesn't have to just be junior doctors. It can be medical students. It could be nurses. Whoever you're teaching, just have them fill it out. So he had done another one because he had also done a teaching for Journal Club. Journal Club is also a very good place to go ahead and talk about things that can get feedback for. So he had what our postgraduate center would do for Journal Club. It was really nice. They would condense all of the feedback forms onto one form and give an overall assessment of the comments. So that's why this is only one page. And then that was, the extent for our teaching experience. We go on to the next section, quality improvement, okay, which is demarcated again by another tab. So that would have already been mentioned initially in the beginning, and if they wanted to go directly to our quality improvement, they would know which tab to get to. All right? So the importance of quality improvement and audits it's extremely important. It's something you should really, really get done if you want to make sure that your portfolio has enough points and is really strong. We have several posts really and articles discussing about audits and quality improvement programs. The best thing that you can do if you're unsure is to go speak to your audit and governance departments and ask them, is there any audit that you can participate in? Ask your consultant or your clinical supervisor, is there anything that you can do? You don't have to complete a full circle of an audit, but at least if you can get through the main bits of the audit and then present it to the relevant departments, because that's very important. It shows that you've got that thing in the back of your mind that you want to make a difference, then that will at least go a long way. So during our whole thing, we had done a national audit and several other audits on our own. You don't have to do several audits if you don't want to. It's just we had the opportunity to, so we went ahead and did it. So for an example, this was the audit that Ibrahim and I had done in A&E. It was about the indications of plain abdominal x-rays in A&E. And then what we've got here is all the stuff that we did with this audit, all of the tasks that we completed. For instance, we presented the audit, we did data collection, analysis, we wrote the report, we did the project design, and we put together an action plan. So these are the kind of things that you want there to be on your certificate so that they can know exactly what your role was in the audit. Okay? Alrighty. After that, what we provided was the actual slides of our presentation for our audit. So this is just our PowerPoint that we put here. We've got some talking points that we've shown, the information and data that we collected, what it all meant. When you do an audit, it's really important that you understand the audit for that reason, because in the interview, they can easily just be like, hey, I saw that you did this about that in your audit, and what does that mean? I mean, what were you hoping to do? So please make sure when you prepare for your portfolio station, you know the contents of your portfolio very, very well. Because the whole point of that station is they're going to be asking stuff about your portfolio, and you will not have your portfolio. They will take it from you when you come for the interview, and the consultants or whoever's doing the interview will have it in front of them. You can't just be like, well, let me just take that back and look at it, okay? So know what you're talking about, know what you're doing, and make sure when you're explaining it very well so that they're confident that you know what you're talking about. All right? The next section we're going to talk about is commitment to specialty, okay? And I just want you all to appreciate we have not gotten all of the sections done in our own portfolio that are shown in the entire, in the entire form, the evaluation form that they have at the beginning. The reason for that is we're just not that awesome. And honestly, I mean, the evidence summary form, it has a lot of things, man. If we could do all of those things, that would be fantastic. So don't take it to heart if you feel that you've not covered a lot of things in there. We kept a lot of things empty. And it is what it is. Whatever we did have, we did provide. And whatever we did provide, we made sure we knew exactly what it was, and it was the best thing that we could provide. So, for commitment to specialty, dun, 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 what we've got in there, to get into all of this stuff, we went to the RCP conference. And I just want to plug, guys, there is another RCP conference this April in Birmingham, and you should go, even if you've not decided necessarily to apply for IMT this year, or even if you've already applied. This is something that you can put in. You can put in that you booked going to this course, because it does show commitment to specialty. And the RCP conference, their annual conference of medicine, is fantastic. Last year when we went, we learned so much. We met so many people. There are a lot of really great interactive topics and things to see and new little machines to play with. So definitely, if you have the opportunity to go in April, go for it. Alrighty? Then we have the header of achievements outside of medicine. Okay? So for the achievements outside of medicine, this is really your place to shine. You talk yourself up, all the awesome things that you've done that you think are relevant to your application, and that this should be ideally something that sets you apart as well. Because the good thing about being a doctor is, you have the opportunity to do so many other things and have hobbies and be participating in many things that are outside of the medical field. So, just because you think that, all right, no, everything in this application or this stuff has to be about medicine, you can still talk about other things that you do, like you volunteer. Maybe you, crochet sweaters that you donate. Maybe you grow out your hair and donate it to Locks of Love. Whatever it is that you do, talk about those things, and I'm sure because it's something that you love to do, like if you participate in a bunch of different clubs or, roadtouk or anything like that, I'm sure you're passionate about it. So show that passion. This is your opportunity to kind of, blow your own trumpet and talk about how great you are. Okay? So what we talked about in ours, essentially, is that we talked about roadtouk. We talked about the kind of stuff that we do, and we kind of talked about what we provide in the website. We're going to switch the battery real quick. Sorry, guys. I'm going to keep talking, and then we'll get the camera back up. We actually did not know when we had applied or started to apply for IMT that we could talk about the blog as an achievement outside of medicine. It was actually one of our consultants who we interviewed for Ask the Consultant who mentioned it to us. And it's fantastic. I mean, it was a really good talking point in my interview. The consultants there were pretty interested because we also gave a summary of our YouTube videos, and we talked about a couple of the things that people have told us that, how we can improve or make things better and all that kind of stuff, because we've taken some feedback from a couple of individuals who used our site. But yeah, it could be anything like that. So if you do something exciting and amazing and it's something that you feel needs mentioning and is good to be mentioned, then definitely mention it. Because like I said, this is the kind of the stuff that can be used to set you apart. It doesn't always have to be really boring, cut and dry stuff. The interviewers are not there to just, consistently judge and analyze every aspect of your medical career. Whatever you've done, maybe, you've written something that you're really proud of. It doesn't even have to be medically related. It can just be something good. Maybe you published a book or like on some nonfiction or fiction book. That is an achievement. I mean, if I could do that, I would be talking about that all day, to be honest. All right. Now the next thing, the training courses that you attended. All right. So the one training course that all of us will have either attended or plan to attend before our IMT starts is ALS. But that shouldn't be the only training course that you put in here. While you don't need ALS for your you won't need it the day of your IMT interview, you can show the booking as proof that you're going to do it, or try and have it booked at least before the IMT starts and all that good stuff. But the other things that you can do are things that I think are very important, because again, these are going to be things that set you apart. And in a way, they do go back to your commitment to speciality. So, of course, we've got ALS. But what else you can do, or things that we will discuss, we did immediate life support, or ILS. So I'm sure a lot of you guys did BLS either back home or here in the UK, but BLS is pretty basic. I mean, anyone can do BLS. You don't necessarily have to be medically trained. But ILS is the next step. And it's good if you do ILS before ALS, because it kind of helps you conceptualize what ALS will be, because ALS is kind of a big jump if you've only done BLS. So I was lucky in the sense that my trust did provide ILS, and it was free of cost within the trust, so I went ahead and got it done. So if you are currently working in the NHS, just speak to your postgraduate medical center or your postgraduate medical department and ask them what other kind of courses they run, and see, when you can join them, because they're really good things to have done. It doesn't always have to be boring stuff like, advanced life support training. There should be other things like alert. Alert is really fantastic. I would even say if you would do it before ILS, it would be very useful. Alert isn't something only for doctors, nurses, healthcare assistants, a lot of other staff also do alert. It's kind of like BLS 2.0. So it's more about recognizing when a patient needs help based on a lot of different things. And again, this was something that my hospital provided, so I took up that opportunity to go ahead and do it. Okay. Another thing we did, we attended a MAX course, which a lot of deaneries have. Some deaneries, I know, unfortunately, only keep it so that, if you're a trainee, you can do it, or it's only for within that deanery and you can't attend from another deanery. But definitely check out the MAX courses website. The one we went to was called Leadership for Doctors and Advanced Clinical Practitioners Early in Their Careers. What a title. But it was fantastic. I learned so much, and the people that taught it were really great. We kind of discussed, what it means as a junior doctor in a role in a setting where, maybe people don't necessarily want to listen to what you're saying because you are so new to the system, but how you can still use that opportunity to to show your abilities and be better. Beyond that, we did a bunch of the courses that our hospital offered. I think our postgraduate center maybe got sick of us at one point. Another one I did was completion of a training workshop on the fascioiliaca block. And I know that's a little more surgically, but it's still something that's a useful thing that I did. Then we've got some ELFH trainings. So I'm sure all of you guys must know about the e-learning that you can do. ELFH is basically e-learning for healthcare. There are a lot of little courses that you can complete on there, and they give you certificates. So do them and add them to your portfolio. The one that's here is on teaching and facilitating learning, which is a great thing because it backs up a lot of what you are talking about and your other parts of your portfolio. So look for things that kind of stack up and reflect on you well in that sense. Then we've got a bunch of other stuff. We had an NIV simulation day. We had a teaching on how to do an appraisal and how to participate in an appraisal. And of course, we had a training on audits, how to do an audit together. We also did a training day on ABGs, how to do ABGs and how to read ABGs. So all these things can be put into your portfolio. Don't worry about what you think is too much or too little. Just don't get crazy about the amount of things that you put in there. Whatever you put in there, whatever you put in for points, you just need to have the proof for it, okay? So that is the portfolio bit of everything. I'll just put this back on down. Okay, do any of y'all have any questions regarding the portfolio? I'm just going to see if there are any questions beforehand, and in the meanwhile, if you guys have any other questions, please let me know, and I will get to them. So I'm just going to scroll on up. How can CV be a guide to the contents inside the file when the CV doesn't contain the evidences and the details about the competency side? No. You'll get an evidence summary form. You print out the evidence summary form. If you look on our post on internal medicine training, the IMT prep, planning your portfolio, we've given a screenshot of what it looks like. And it basically has a bits where, you'll be like additional undergraduate, degrees, any postgraduate degrees. And it'll talk about, presentations, publications. That's the form that you're going to be putting in the front of your portfolio. And that's where you're going to basically be discussing all the bits and pieces of what you have and what you can provide and what you can show. Okay? Because it tells you there what page is it on, is the evidence provided within the folder. And then at the very end is where the person who takes your interview is going to talk about whether or not they found it to be something that needed to be provided and if it was appropriate to provide. Okay? Sorry, it's scrolling down with every new comment. I'm trying to keep up, guys. Okay. How much proof is needed for each aspect? As much proof as you can provide. I mean, like I said about any of the teachings that you did, if you just have a teaching certificate and a couple of pages of feedback, that's enough. You don't need to have a video or a picture of you doing it like, look, this is me with my presentation. That's too much. But just the basic stuff. If you have a certificate, obviously that's going to validate it because it's not like your consultant would just print it out willy-nilly. But remember, whatever's appropriate to whatever you're providing. If you're talking about, stuff like you're going to present something and then, 50 people attended because it was grand rounds and you've got 50 forms of feedback. You don't need to provide 50 forms of feedback. Just give, like we gave, I think we gave 5 each for each of our teachings, even though we had more than 5 people who were attending. It's just the crux. And obviously, you put in the ones that give you the best feedback. Like, your little life tip for the application. But definitely at least put in a consultant one or a registrar or a couple of those to mix it up. Don't make it seem like it's only one thing. Try and show a variety. Some medical students, maybe some advanced nurse practitioners, etc., etc. Okay? I'm sorry the video keeps buffering. Please check your internet connection. Sorry. All right, you're at the data collecting stage of a QIP you're participating in with an ST1. Can I have them do a letter stating what I'm doing? what I would suggest is if you instead go to the audit department and they will give you that, because what we got when we got our form, it was actually from the audit department and they put it in their nice little template and they said these are the things that were done. The thing is not to put down an ST1 because I mean we're at the same level right now, but it doesn't come with as much weight because if you look at our form, we've actually got it signed by a consultant and we've got it signed off by the head of the audit department. So it validates it a lot more in that sense. Okay, is teaching experience a must? Well, no. The evidence summary form has a lot of things that we didn't provide, which if you said they're a must, maybe nobody would really get into IMT. But if you can do something, do it. It doesn't have to be anything super extensive. If you do some sort of post round with some medical students and you're just talking about how to approach an ill patient, it's so easy. I mean, you just get some feedback forms from them filled out and you're done. You're set. You've got your teaching experience done. Try, if you can, to vary what kind of teaching experience you've done. Like, for instance, I did 2 teaching sessions in my A&E and then 1 journal club teaching, so that gave me 2 different types of things. You could also do something like that, or if you do a grand round, or if there's any other ward-specific teaching that you can do, go for it. Okay? Does the portfolio only contain copies of the evidences and not the hard copy real version? So you can provide either. It's up to you. I know a lot of people are like, we'll provide the real thing if we have the real thing, that's fine. And you've got them in page protectors, just don't lose anything. It's just on you. And a lot of these forms, a lot of the certificates you get are emailed to you, so there's really not an original in those things, but if there's anything that is actually the original of whatever you're providing, if you want to provide it, go ahead. Just be careful. Okay? I've started a trust grade FY1 job in January. I have 1 year internship experience back home. Am I eligible to apply for IMT? You would be eligible after you've completed 1 year here. I mean, you could have done 1 year back home as well, but you just need 12 months of experience after your internship. I don't know how long you've been, you started in January. I'm assuming January 2020. So you need to be working until next year, and you would be eligible. You can apply beforehand. You just need to have 1 year of that working experience by the time IMT starts, by the time your session starts. Please also make sure that you have your FY2 CREST competency signed off. I know you've said that you're in an FY1 post, so that might be difficult to do, but you should speak to your consultant or whoever is, taking care of you, your clinical supervisor, and tell them that this is your, your goal, that next year in November-ish you want to apply for IMT. What can you do to make sure that happens, and how can you make sure that those things are signed off on your CREST form? All right. Right? After signing the CREST form, do we still need to do DOPS, mini-KEX, etc.? You can do them for yourself. I mean, it's up to you. Honestly, look, I mean, if you want me to really kind of break down in the sense of how can you really show what you're doing, because a lot of people do ask, well, how can I prove that I'm doing these things for my CREST form? Speak to your postgraduate medical center, see if they provide a free Horace e-portfolio. Ours did. I'm sure many others do. If not, if you should at least have a clinical supervisor. Speak to your clinical supervisor in that department and tell them, look, I will, provide, documents you can print out from online, the kind of forms that they have for DOPS or for mini-KEX. But after you've gotten your CREST already filled out, you really don't need to do any of those things because it's done and you've got the CREST form filled out. But you can still do them if you want to. No one's going to stop you. Okay. Can you add stuff you did in medical school to the portfolio? So, I mean, it could be maybe if that was an achievement that you did. There are parts in there that they talk about at what level you graduated, like if you were in a certain percentage of your graduation, that you can talk about that. If you did some research, if you did anything that really fits what's on the evidence summary form, okay? I mean, I don't know, like, if you did any publication, I wouldn't necessarily put that, in your physiology professional exam, or not maybe your professional exam, or your term exam you got first or something. I don't think they really care about that. But like if you did get some sort of achievement in your professional exams, or if you graduated within a certain percentage, there is a section of that on your evidence form that you can kind of talk about. If you've got any sort of distinction, whatever is the equivalent in your country, in your medical college, that equates to what they've said, then you need to provide, proof of that. Okay. Most of my evidence is non-NHS, like teaching Atlas ultrasound courses, does it count? Yes, you can still provide it. It doesn't have to all be NHS related. There are people who directly apply into training posts, although we don't recommend it, but they are still able to do so because they can provide evidences that they've done these things from their home country. Okay. How a pediatric portfolio be? All right, I'm so sorry, I don't know because I have not done a pediatric portfolio, and this is about internal medicine training. I do apologize though. They might say it on their website how it should be, like they do for IMT, but I'm not certain. Okay, I've answered a question similar to that about medical school. Should we include DOPS, mini-kexes, and CBDs? You don't need to include them, but if you have something that's really relevant and you want to put them in there, you can. This is again something maybe towards your commitment to speciality and that stuff. But don't think that you are, hardbound to provide it. Okay. So I've given myself 8 points for leadership and management for starting and running international medical journal. Is that okay? I don't remember off the top of my head how many points are given to one thing, but it really comes down to the interviewer if you can sell it to them when you're talking about it. So when they do ask about these things, make sure you do talk yourself up and talk about the roles and your accomplishments and what you did and how you made a difference with what you did. And then they give the weight of those points accordingly. All right? I know some of the other questions here are about the interview itself, so let me start talking about the interview. Okay? When you book the interview, there are a bunch of different cities you can go to for the interview, and you will need to ask for leave. So this is usually, special or professional leave that you'll ask for from your rota coordinator and your postgraduate medical center. This should not be annual leave or study leave. This is a separate sort of leave. It does not matter which city you go to. It's just the city should work for the day. The day should work for when you go. For instance, I was in Yorkshire. Leicester, which is pretty close by to where I was, had a interview date, but I couldn't attend that day because I was on call and there was no way to get any sort of swaps. So I went all the way down to Cardiff, and I still got into IMT. Just as much as anyone who were, I think they had last year, like Newcastle, Cambridge, which were all much closer, to where I was. It's just the dates didn't match up. So they let me have, the 2 days I needed. If you need to travel, make sure you keep that buffer. If your, IMT interview is like 4 hours away, do not wake up at like 4 o'clock in the morning to get there on time. Just don't do that. Like, give yourself the adequate amount of rest to get to where you need to be and be confident in what you're doing. All right, dress comfortably, but dress professionally. A lot of girls ask me if they should come in high heels. If you're comfortable in high heels, I personally wore flats because if I got any taller, I feel like I probably would fall over. But it's up to you. I wore, professional, dress pants, dress trousers. I wore a blazer, and that was it. I was set. Go for it. I know a lot of guys who came suited and booted. Fantastic. Everybody looks good in a suit. Guys, make sure your hair is not too long, or if it's long, make sure it looks clean. But be clean. Like, I don't know how else to put it. Guys can have long hair, but just push it back, make sure it looks good. If you got a beard or a mustache, make sure it's like trimmed. It looks fantastic. You don't have to adhere to NHS kind of situation. You don't have to have the sleeves rolled up. Your sleeves could be fine. If you want to bling it and wear jewelry, go for it. But it's not a wedding. So I said that about makeup too. It's not a wedding. Don't get crazy. Just go as you would to any sort of professional interview, because that's what it is. It is a very professional interview. And remember, even though they might tell you that your interview starts at 9:30, there might be some delays. Make sure you have a very good breakfast. Be ready to wait if you need to wait. So that's why it's very important whatever you're dressed in is something that you're comfortable in. If you are traveling and you have luggage, please contact the center beforehand to see if they'll be all right with you keeping your luggage there. Most centers tend to be, but it's still a good thing to know. If it's a day that maybe it's raining or snowing, please make sure you have the appropriate weather things so that you aren't in a situation where you get drenched in rain and then you walk in, squishing your way to your interview. It really does come down to how good you feel. If you feel confident and ready for that interview, you're going to do really well. So now let's talk about how the interview is. All right, when you get there, you need to submit your portfolio. You'll also be given a paper like that paper that we talked about in the beginning that kind of tells you what's going to happen that day. And you sign a form that basically says that you understand all the information that's been provided to you, and that you promise you will not talk about the questions and the stations that you have today. And that's really important, guys. All right, it's a huge probity issue. Please, please, please do not talk about your stations. It's such a simple thing, but it's something that could potentially destroy your entire career. And it's not worth it. It really isn't, okay? If somebody tells you, oh, but you're not a good friend if you don't tell me, dude, that person is not your friend. Because people have messaged just asking, what if I talk about it? Do not. You've signed a form saying that you will not, honor that signature. Do not talk about it. After you do all that and you've submitted your portfolio, you need to also have brought with you a photocopy of, I believe it's the first page of your passport, the passport page that has your signature, and I believe where your vignette is, but I could be wrong about that. It's in our post about what you have, what goes down on your interview day on our IMT prep section. But basically, after you've done all that and your portfolio is gone, you're just kind of sitting, waiting to be called. All right, there's going to be a bunch of people there. If you want to sit there and sip some coffee and not think about life, go for it. The book that I keep talking about, Up and Low and High and 5, is this book right here, The Medical Interviews Comprehensive Guide to CTST Registrar and Interview Skills. So this book, I used it for my job interviews when I was doing a trust grade job. I used it for plab 2. It has some really good ethical scenarios. I used it for my IMT interview. This book is like the holy grail. It literally covers everything and anything you need to know. I've had people tell me, well, but it's so long. It really is worth it, though. You need to put out the time to sit there and read it and get through it and understand exactly what they're asking you. Because I found after I went through this book extensively and then I went to the interview, they were basically asking me what was in here. And the way it tells you how to respond and how to structure and format is super important. Because you've got 5 minutes between each station. There are 3 stations total, and you've got 10 minutes in there. In those 10 minutes, you need to present the best version of you, be it in the ethics station, be it in the clinical station, be it in the portfolio station. You need to know in your mind's eye, how am I going to say what I need to say to make them understand that I know what I'm talking about? If you cannot do that, even if you are super qualified and you know you get into IMC, it unfortunately will not work in your best interest. It's a very short amount of time. And it's like what they say, the first impression is the most important impression. And these are people who are just having that 10-minute window and that's it. So each station will have 2 interviewers in it, okay? So let's say your first station is your portfolio station. So while you're sitting outside your portfolio station for those full 5 minutes, you're basically just looking at your feet because there's not anything for you to read. Everything's going to be inside. Your portfolio will be in front of the interviewers. Of those 2 interviewers, they may feel that, they'll ask you questions in a ping-pong manner, like one person, then the other person, then one person, the other person. They might ask it separately. Maybe only one person asks, and the other person's just, writing something in the back, and you're wondering what they're putting down. Don't worry about that. Just concentrate on what they're asking you. For the portfolio section, they may just pick a section like, your teaching experience or your achievements out of medicine, and they might ask you, tell me about your achievements outside of medicine. Or they might be like, tell me about some teaching that you've done. Tell me about some courses that you've attended. That's why it's really important that you know what's in your portfolio so that when you're talking to them about it, they have it in front of them and they can see and they can look and be like, yes, this person has done these things, this person has done these things. And that helps your case because they're going to be putting those marks accordingly. Okay, and we'll talk about the marking system in a bit. But remember, that's where you are, you talking about your portfolio. When you're there and they're asking you questions, try not to do what I do a lot, which is ramble. All right, and I know it's really difficult because you're super nervous and you're like, oh, I want to talk about this, I want to talk about this, I want to talk about this. You don't have time. 2 minutes to 3 minutes, get the point across to them. This is what I've done. This is what I've achieved. This is how I'm awesome. Give me points. All right? Don't say that, but you get what I mean. That's what they want to hear from you. All right? They want you to give them the crux of what you've done. The condensed, this is who I am as a doctor, and this is why you should give me these things. They're structured, mentioned in this interview book, like SPIES and STAR, that honestly are a godsend. If you just keep it in the back of your mind, and that's how you're going to do it, go for it. I think the portfolio section is probably the best section to practice with another person. You don't really need to necessarily practice the ethical and clinical scenarios as much as the portfolio, because it's just about, like in plab 2, when you're talking to someone, you want to come across as natural. You want to make sure that you're following the structures that you did in your trust grade interviews, like camp, and you want them to know that you're good, because that's what it comes down to, you being confident. Okay? After those 10 minutes are up, you go back outside, you sit in another chair for 5 minutes. Let's say your next station is the clinical scenario. Okay? In those 5 minutes, they will tell you, when you can pick up this little paper that literally will tell you what the scenario is inside. It is plab 2 all over again, if any of y'all have taken plab 2, or I guess it's kind of like PACES in a way, but there's not going to be necessarily a physical patient. The interviewers inside, there'll be 2 interviewers. One may act like a patient or just tell you in general that there is a patient there and how will you approach it. So if you've got the scenario there, you go in, you've got, I forgot to mention, you've got a little badge that has your information on it. They've checked that information, and bam, present to them how you would see this patient. It does not matter what the patient is. The first thing you do, as you would do in real life, is you introduce yourself and you go through A, B, C, D, and E. You stay through there, you're set. I always like to say, if I get lost, the first thing I come back to is A, B, C, D, E. Come back to my A, B, C, D, E. ALS teaches you the exact same thing, and there's a reason for that. You might be missing a trick, so if you come back and review, if you see what's happening, you're good. All right? You go through the airway, you go through breathing, circulation, disability, and exposure, and they may give you then prompts in between, like, oh, well, the patient's blood pressure is like this, or when you pull back this, you see this, etc., etc. Okay? I prepared for this from the Oxford Handbook of Clinical Medicine. There is an emergency section. That whole section is gold. Just go through it. If you've already been working the NHS for a while, it is something that's a little bit easier because you've worked on calls, if you've, post-taken patients, if you've worked in A&E, these are basically those kind of patients. The patients in resus or the patients on the medical ward or something like that. These are the ways that you know how to approach and talk to a patient. Again, be extremely confident, but do not be overconfident. They are not looking for a registrar. They are not looking for a consultant. They are looking for a junior doctor. So know your abilities and know your limitations. If you are put in a situation where in real life you would not do something by yourself, do not say you would do it in the situation, okay? I'm serious. Like, it's not that they're going to give you extra points. They're like, oh, this doctor, they're stepping up to the wall. No. What they're going to be thinking is you're not a safe doctor, because that's what it comes down to. We've got a post on how to be a safe doctor, and I think it's a really good thing for you to kind of run through if you're wondering what they're asking about. But there are situations that I'm sure many of you have faced in your daily, NHS hospital life where you're like, I need help. I need a senior, or I need someone else here. If you're in a real life situation, a patient collapses, do you start just doing everything yourself? Of course not. You call out, help, help, I need help. And whoever comes running, you tell them, all right, this is what we need doing. I need this phoning. I need this, accomplished. You may be taking charge. You might be leading in a certain way, but you're not doing everything yourself. And that is extremely important. Remember that you are a person and you have your own limitations. I've had people tell me, no, but I want them to know that I can do these things. You know what? I'm sure you can, but it's not safe. Okay? And that's what it really comes down to. The second part of your clinical situation might be, where the aftermath of whatever you've done. Okay? You might need to say, okay, I've taken help for whatever I did, then this is what would have happened. And then they'll tell you, okay, you've done all these things, you've told us what you wanted done, and this is the outcome. Or you might have to explain something to the patient. Essentially, the whole clinical scenario really does play out like a plab 2 station. I don't think any of you have anything to worry about if you use the Oxford Handbook. People have asked me, should they do a course? It's up to you. I didn't do a course. If you want to do a course, do it. It's just your comfort level. I really didn't even have time for a course, to be honest with you, because I was working on calls and I came off of on call and I went to the interview. So it was just more convenient for me to study on my own time and knowing how I can pace myself in review. And what I also did, which is something I would suggest, is one of my consultants actually is one of the interviewers for IMTs occasionally, for the IMT interviews occasionally, and he just kind of gave me a general prep talk pep talk, really, like, this is what you need to do, this is how you need to be, which is kind of relayed to you guys now, and I found that to be super duper helpful as well. So then you're done with your clinical scenario, they tell you you need to move, you get up, you go out, another 5 minutes, it's your ethical station. For your ethical station, you guys, do not read anything but this book. Really, this book covers all the things you need to know, ethically speaking. I mean, some of it I want to say is common sense, but then you're put in a situation where somebody's asking you something in an exam and you seem to forget your common sense. So it's a good idea to have this book kind of give you a structure of how you need to talk to a patient. We know not to be brusque or not to be rude, okay, when we're in front of a real person. But if it's an interviewer asking us, okay, this person's crying, what would you do? You'd be like, if you aren't thinking about it, you'd just be like, yeah, I'd comfort them and offer them like a box of tissues and tell them everything will be okay. But the interviewer is not going to kind of get that feeling that you do that. You have to speak in that way. Like, what I first make sure is that the patient or family member, whoever it is that, in that situation, is all right if I talk to them. You've gotten, confidentiality out of the way if it needs to be taken out of the way. You will say the stuff like, I will make sure my bleep is with someone else so it doesn't go off while I'm talking. I will take them to a side room, make sure I have somebody else with. It's a whole format of how you do things. And I know you guys would do this in real life, but we don't end up saying those things. And they're not mind readers. They're not going to know, well, I know Ibreez. She's real nice. She would make sure that person is taken care of well. They don't know. You need to be able to make them understand that what you're thinking is what they're thinking and that you guys are on the same, track. The ethical scenarios are, I think, where a lot of IMGs suffer because of this. They know what to do and they know they would do it in that real life situation. It's just we don't say it. And I don't know why we don't say it. It's just like you would, just think of it if it's a cardiac arrest and you need to give that patient adrenaline, but you don't say it. No one's going to give that patient adrenaline unless you say it needs to be done. It's the same thing. They're not going to believe that you know that in order to comfort a patient, this is the steps that you would do, or in order to talk to your colleague, these are the things you would do. And again, some of these were like plab 2 stations, the ethical scenarios. Just be confident about what you're talking about and try not to ramble again. And be very, very attentive to the question that they're asking you because they can try and trip you up with things that you haven't thought about. Also remember, as an overall situation to all stations, if you do not know the answer to what they're asking you, there is no harm in saying, I don't know, or I will try and find out. Okay? Don't say something then, you just kind of dig a hole for yourself and you're not really certain what, where, and how. Alright? So let me just make sure I've gotten all the points I want to talk about there. Yes. IMT interview, they ask you to show up at least 30 minutes before. I showed up an hour before because I am super paranoid about getting lost and ending up in the middle of nowhere. Plus, I'd never been in Cardiff before, so it wasn't something that I was willing to do even with Google Maps in my phone. Make sure you travel comfortably there as well. You don't want it to be that, if you take a train there, then you've got to hike up a hill and get there. If there is any way to take a taxi or an Uber, Lyft, whatever, if you guys are all carpooling, fantastic. Just make sure you get there and your outfit is not ruffled and you don't look all wrinkly and all that kind of stuff. Okay? So we talked about what to bring. We talked about leave. All right. So after your interview is done, they will hand you back your portfolio. And luckily, since mine was so bright, I just knew which one was mine and picked it up, proved who I was, and I got out. They'll take back your ID badge and everything like that. They'll give you a quick survey, ask you if everything was fine. If anything happened during your interview that you think needs mentioning, for instance, if you, saw someone cheating or you thought that the interviewer wasn't listening, they were texting during your station instead of paying attention to what you were saying, that is your opportunity right then and there to talk to somebody about it. Do not leave that to tomorrow or next week. Just like in plab 2, if you feel that there was any discrepancy that could affect how you were being judged, please mention it, okay? No one will get mad at you if you mention it. It's a big deal. It's a huge interview. You put it, a lot's riding on it. So don't just put it off if you see something that you think needs mentioning. Okay? But basically, yeah, after your interview, you won't be able to know what you've gotten until all the interviews are done. And then they'll ask you to do some ranking of your preferences afterwards. But we're going to do that in a whole separate session. We'll talk about it then because right now I know everyone's really concerned and worried about the interview portion. So definitely go through our articles on how to put together your portfolio and how to prepare for the interview. But let me see if you all have any questions that have come up in the meanwhile. And if you do have anything else that you want to know about the portfolio or the interview session, please let me know. All right, let me see where we've gotten to. Do they ask questions about the topics related to the training course that have been attended in the past? They might ask you. Yeah, they can. I know they asked me extensively about my audit. So whatever you've attended, make sure you know what happened that day and you know what you learned, because they could easily ask, because I also attended one for NIV. And if there are any points, they might ask you, what are the indications of NIV? It's a completely legitimate question, because if you attended that, you should know what happened that day and what you learned. Okay? Do I need any MSc in desired subject to get a training post? No, I don't have one. I don't know a lot of us right now who are in IMT that do. It does give you extra points. If you check the evidence summary form, it does give you extra points. You can provide it and you can do it. I wouldn't say stave off starting IMT to complete a master's or an MSc. While in IMT, you could even do it if you want it to add towards your specialty training application. But it is not something that you must have, that you need to have in order to get into training. Okay. So do you guys have any other questions related to the interview? If not, we will wrap it up. I'll just give you all a second. Just to kind of do a quick and brief summary of everything we talked about. We talked about the portfolio, what to put in the portfolio, how to make it beautiful, what you should know about your portfolio, and how it should be structured. And then about the interview, how early you should get to the interview, how to ask for leave for the interview, how to dress, what you can expect, how the stations would be, and what happens afterwards. I know a lot of you guys have your interviews coming up, and I just want to, I want you guys to really know that it's nothing to get overly stressed about. You've got this, good luck. I think the more stressful part is probably the ranking, and then waiting to hear back, I guess, about where you've been listed for your rankings and everything. But really, it's just another job interview. If your hospital provides any sort of prep, like, to see how the stations are, do them. But don't overwork yourself. The night before, maybe, your interview, maybe just take a break, go out, have something to eat, refresh your mind. Do not agonize about the interview after the interview is done. Whatever is done is done. Don't think about it again. Just get back to what you need to be doing in your work and in your day-to-day. And then when it comes to hearing back, you'll see where you've gotten to. Okay? Is the clinical station a role play or a conversation, or is it like explaining yourself only? It's really up to the interviewer. So for mine, since there were two, one person was just kind of asking me the question and telling me this is what needs to be done, so what would you do next? But the other person actually pretended to be the patient. So it's up to you, and it's up to them. If they tell you, because I kind of asked how to go about it, and the first person was like, no, you just tell me what you're going to do. But the second person, when I asked how should I go about it, they're like, pretend I'm the patient. In my ethical scenario as well, when I asked it, they said, no, pretend I'm the patient. So clarify, so that you won't awkwardly be like, okay, so then I do this, then I do that, and the person's like, I am a patient, I don't understand what you're saying, or something like that, okay? They're very nice, they're very helpful. Ask them, and they will tell you, okay? Which documents should be part of the eligibility folder, and should it be kept in a lever arch folder as well? Ah, I see you have come late to this. That is okay. So yes, it should be in a lever arch folder. This is a lever arch folder. Okay. We provided links in our article so people can know exactly what you want. You can buy them on Amazon. You can get them at the store. I think B&M and WH Smith have them. It's up to you, dude. Just whatever looks good, get it. Make sure it's a professional kind of color, nothing too crazy. But the documents that you provide in it are as per the evidence summary form, and you just put them in there and some page protectors and make them look beautiful, and you're set. Cool. Cool, cool, cool. I would like to think then that I have answered everyone's questions and concerns regarding internal medicine training. So if you guys are applying for the interview, going